All right. So we are heading out, do a little bouldering. Did a 15-mile run yesterday up in the mountains way up there to Green Valley Lake and back from our house, and felt okay. Been dealing with a couple of injuries this year, so I'm trying to ease my way back into the training. So anyway, do some bouldering, mix it up a little bit today, right? So I thought today in Physio on the Go, we might talk about why we have to have soap in our lungs. Seems like a strange thing. Did you guys know you have soap in your lungs? No? Yeah, that's kind of weird. Have you been swallowing soap? No? Okay. Okay, well that's good. So I'll press that log there. Yeah. Yeah, this creek is right up. So, it's true. If the fluid inside of someone's lungs comes out, it's super bubbly, like a bunch of soap. Yeah, so we have a bunch of kind of soap bubbles, in theory, hanging out in our lungs, which seems like a strange thing to do, but it's the case. So I think we're going to have a little discussion here about how we ventilate our lungs, which is how we get air in and out of our lungs. We already did another episode where we talked about why we have to breathe to get air in and out of our lungs. But today, we're going to talk a little bit, move some trash out of the way. People come up here in the wintertime, which is fine. They leave their trash everywhere, which is not so fun. Find everything up here from sleds to toilet paper to who knows. But so if you come to the mountains, don't do that. All right. Anyway, so how do we get air in and out of our lungs? The process of ventilation. All right. So that is what we're going to discuss today. We just got to our first little warm-up boulder area here. Do a little bit of climbing and a little bit of thinking about physiology. Physio on the go. Yeah. So we'll begin the discussion in a second here when we're going to talk about how air gets in and out of our lungs and what variables affect that. Resistance of the tubes and compliance of the air sacs. So I'm going to take a pause here, get us all set up for some bouldering, and come back to this. All right, so we're got some crash pads set up for the kiddos here to get going. I'm going to jump in and do a little bit of bouldering myself to try to limber up a little bit. So we're discussing how you get air in and out of your lungs. That's important to do. Apologize for the car noise, but we're kind of across the street from Snow Valley, and that's the 18 traffic going back and forth to Big Bear and what have you, but still generally a pretty nice spot here. We got a bunch of sun there, but you can see here kind of a nice little area. We like to come up here and do some bouldering when we can. All right. So we get air in and out of our lungs. Yeah. Because air, just like any fluid, will go from high pressure to low pressure. Okay. So how do we lower the pressure in our lungs? We got to expand our lungs. We do that by pulling down on our diaphragm and maybe up and out with some other muscles to expand the thoracic or chest cavity. And that allows air to come from out here in the atmosphere where the pressure is then lower down into our lungs. Okay, so that's Boyle's law. Maybe we'll talk about that some other time. But we have to be able to do that to get the air into our lungs. To get the air out of our lungs, we have to compress the lungs. Now the lungs are elastic, so they will squeeze back on their own. But sometimes we can squeeze on them with our muscles too, and decrease the volume and raise the pressure in our lungs so that the pressure is higher in the lungs than out here in the atmosphere, and out comes the air. So the air is coming in and out, from high pressure to low pressure, depending on if we are expanding our lungs so that air comes in, or compressing our lungs so that air goes out. Okay, fine. Whenever we have a pressure difference across a tube, we have tubes into our lungs. Okay. Now that is going to cause some air to go. But how much air is going to go depends on two variables. One, what is the pressure difference? Are we expanding our lungs a lot or compressing our lungs a lot? Okay, so that would make a big pressure difference. So that'll give us more air coming in and out. The other thing that affects air coming in and out, though, is the radius of the tubes. The resistance of the tube. So even if we are pulling in really hard, if our tubes are narrow or constricted, then that's not going to work well. Because we'd have a high resistance. Okay. And same thing trying to get the air out. Okay. So we'll have a discussion another time about obstructive versus restrictive lung diseases. Okay. But for the time being, one variable that affects getting air in and out of our lungs is the fact that our airways have a resistance, right? So here, we're going to try to use an outdoor chalkboard here, and hopefully I don't know if we can even see that, but I like to think of our lungs like a tube and a big balloon. Okay. So a tube and a balloon, all right? The airway is the tube. All of our little lung sacs put together make up the balloon. Yes. So the property of the tube that matters is the resistance. And so when that tube gets narrow, then the resistance is high. That's all we're going to say about resistance. We're going to focus on the balloon part. All your little air sacs together making up one big balloon. Okay, so one big balloon inside you. Okay. The other thing that affects how much air comes in and out of your lungs is how hard is it to inflate this balloon. Really, it's millions of tiny little balloons, but how hard is it to inflate those balloons? Okay, so I don't know if you could see that or not. Doesn't really matter. But we're going to come back and talk about that. That's the compliance of your lungs. All right, so just a quick video of the kiddos climbing. Tanya's up there and Judah's over there having fun. So we're going to pause for a second, do a little climbing, and I will come back and finish our discussion about compliance of our lungs. All right, taking a quick little break from warming up on the boulders. Maybe get back to our discussion a little bit on, yeah, it's good. a little bit to our discussion on breathing in and out, ventilating the lungs. We talked about resistance of the tubes a little bit, maybe come back to that some other time. But a lot of people could understand that one. The other thing is we want to talk about the property of the air sacs themselves. Yeah, how easily, mostly, do they inflate? That's the main thing. Sometimes we're worried about how elastic they are to deflate, but usually we're worried about how easily they inflate. That's known as compliance, how easy it is to expand something. We'll talk about it in the heart. The heart has a compliance. Yeah, and you can check out our discussion on cardiac output and why runners' heart rates are so low. One reason is that they fill up better. They have better compliance. You also want your lungs to have good compliance. You want the lungs to be able to expand easily and fill up very well. Yeah. And there's really two things that contribute to the compliance of the lung. And one is the air sacs themselves. They're usually really thin-walled and super compliant, easy to stretch. And you want that, right? It's easier to get air into the lungs this way. If you have a bunch of scar tissue around those air sacs, well, then they get harder to inflate, right? And the compliance of the lung goes down, and it's harder to fill the lungs with air. So when you have scarring in the lung, in the air sacs, the alveoli to be precise, in the lungs, then they don't inflate as well, and that's not as good, okay? So that's one thing that can affect how well the lungs inflate is the lung sacs themselves. Normal healthy lung sacs, easy to inflate, okay? But scarred lung sacs are difficult to inflate. So, yeah, that's one thing. That's not super hard to understand either, I don't think. You guys are sharp. So, here, look out, Judah. Natania's got to come down off the boulder. She made it up to the top. Yeah, congratulations, Natania. So, we come jump down. We watch you jump down. Yeah. Ooh, okay, that's fine. Okay, the dismount. Yeah. One tip, when you go bouldering, always make sure there's a way off. Yeah, okay. So, yeah. Anyway, so, yeah, the lungs. So, can you guys maybe help back up a little bit so we can go to the next spot? We'll finish this up. So, the lungs are usually super compliant because the air sacs are super compliant. However, there is one other concept, a little bit tougher to understand, and that is the concept of surface tension. Okay, so what is surface tension? Well, the definition is it's tension on a surface. Okay, but what we're talking about is where there's an air and water interface. Okay, the water molecules are polar and they like each other. They don't like the air. The air is oxygen, nitrogen, carbon dioxide. Those things are all nonpolar gases. So they don't really like each other. Yeah. Yes, some air goes into water. We talked about that. Okay, before with our episode on why we need red blood cells. Some air, yeah, okay, fine, but air and water don't really like each other that much. So the water molecules are pulling to each other. The air is staying away. That creates a tension on the surface. If it's just a surface, that's fine. That's how bugs walk on the water, because of the surface tension. Okay. Now, if you put a sphere, though, like your air sacs, okay, and you put a little lining of fluid, they're not full of fluid, there's a little lining of fluid on them, well, then those water molecules want to come together and they want to push the air sac out and then stay together and not inflate again. Yeah. So if we didn't do anything about that little film of water, which we need to have, we can't have our air sacs dry out, okay, that little film of water would tend to cause our air sacs to collapse and not want to inflate because of this surface tension problem that would exist. How do we get around that? Okay, well, so I'll ask you a question. If you want to have bubbles in water, what do you have to add? Here, I'll ask my kiddos. You guys, if you want to make bubbles in water, what do you have to put in the water?
Air.
Well, air for sure, but if you want the bubbles to stay in the water, what do you put in there? Soap. Yeah. If you put soap in the water, it makes the bubbles last, right? Because if we have soap in the bubbles, we're going to see it reduces the surface tension of the bubbles. They will stay that way. If we don't, they just collapse. Same thing in your lungs. You need soap in your lungs. That's kind of weird. That's true. Okay. Why? To reduce the surface tension. Why? So that the air sacs don't collapse and they aren't so difficult to inflate. In other words, it improves the compliance of the lung. Now, where does this soap come from? You're not inhaling soap, I hope. But you make it. Yeah, it's this stuff called surfactant, which is basically a detergent-like molecule that gets in between the water molecules and lowers the surface tension, so they don't want to squeeze together so much. Okay? We have a special cell in our little air sacs called the type 2 alveolar cell, and it produces the surfactant. Critical job, because if we didn't have that, what would happen? Well, the air sacs would tend to collapse and be very difficult to inflate. In fact, when babies are born prematurely, they may not be making surfactant yet, and they would go into infant respiratory distress syndrome because they don't have surfactant. Yeah, and that makes it so that it's really difficult to inflate the air sacs. So it's already difficult to take our first few breaths, but it's really difficult if you don't have surfactant. Yeah, and so they're in real trouble breathing, and so they're going to have to be hooked up to a ventilator. And now we know all this stuff about the soap bubbles and stuff, and so we can have them inhale some surfactant. Okay, so hopefully we now can answer the question, why do you have to have soap in your lungs? Well, really, it's surfactant, okay, from the type 2 alveolar cell. Why do we need that? Because we need to lower the surface tension in our little air sacs so they don't collapse and so that they're very compliant, easy to inflate. All right? I hope you found that useful. And we're going to sign off and go track down some more boulders. Does that sound fun, guys? Yeah, go find some more boulders? Yeah. All right, let's go see what else we can do. All right, take care and God bless. And by the way, if you find these videos helpful, please like and subscribe, maybe share it with some friends. I want to build a little community of folks. Comment, let me know. Hey, I would like to hear about this topic because it's something that's confused me or I'm interested in, whatever. I'd love to hear from you so that we can direct this thing where we're just kind of winging it, having fun with it, but we want it to be as helpful as possible. And my son, Judah, has something he wants to say too.
If you like dinosaurs, check out my channel, JH Dino.
All right, yeah, that's right. And it's JH Dino, and what's your
Dino Films JH.
Dino Films JH is this, so it's at JH Dino and Dino Films JH. Yeah, he has a pretty fun video on 10 interesting facts about T-Rex. I learned something. Okay, take care. God bless.